Hey folks, ever since the World Health Organization declared MPOX a public health concern, I've been getting a lot of questions about whether we need to be worried about this right here in North America. So let's talk about MPOX. So until recently, MPOX was largely limited to Africa, but people will recall that in 2022, we had this massive international outbreak affecting 70 different countries, and that was a type of MPOX that was mostly transmitted through close sexual contact. What's important to understand is that there are two different what are called clades or categories of MPOX. There's clade 1, which is traditionally in Central Africa, and there's clade 2, which is in Western Africa. And that 2022 outbreak around the world was from a subvariant of clade 2. The reason that's important is that clade 2 is much less deadly than clade 1. Conventionally, clade 2 mortality rates around 0.1%, whereas clade 1 was around 10%, so 100 times more deadly than clade 2. The reason everyone's worried is that the current outbreak that we're seeing in Central Africa is from a subvariant of clade 1, and we're seeing a reported mortality of 4% overall and even higher at 11% in kids. So a very different behavior than what we had in 2022 around the world. And we are seeing more cases of MPOX in North America, including right here in Toronto where I am, but as far as we know, those cases are still caused by the subvariant of clade 2 that came here in 2022. But if there's anything we've learned from the pandemic, it's that the world is a very small place and it won't take long for these cases in Central Africa to make their way around the world. So we have to be ready for that. So for now, the good news is that there is a vaccine. So if you're a candidate for a vaccine, go ahead and get it. If and when the new clade comes here, and if we see an increase in cases, that vaccine eligibility might be widened. And if that happens, more people will be able to get the vaccine. So for now, stay tuned.